Roche is a pioneer in healthcare. They have been committed to improving lives since the company was founded in 1896. In this regard, the government of Sierra Leone, through the Ministry of Health and Sanitation, on Thursday, 7th July 2022, signed a memorandum of understanding with Roche Medical at the ministry's conference room, Ubilin in Freetown. While addressing the gathering, the Deputy Chief Medical Officer, Clinical Service at the Ministry of Health and Sanitation, who also doubles as the chairman of the program, Dr. Mustafa Kabar, stated that the occasion is very important for the ministry and the country as a whole because Roche is coming at a time when their services are highly needed and the memorandum of understanding allows them to interact with key players in the medical sector.
The Ministry of Health and Sanitation is poised and is always creating the opportunity for companies, private individuals to come in and support the drive and agenda of the Ministry of Health and Sanitation. This agenda is clearly stated in our aid memoir, which is coming out. Maybe you have a look at it from the conference we had, the consultative conference, in terms of looking at how we can best improve services in Sierra Leone. And one key thing that came out of this conference was that, the Bintumani conference, was that we need to involve private partners. And this is a private company coming into the space, and we are ready to embrace you and make sure that you have a level playing ground in helping us achieve universal health coverage. What we always hasten to say is that we always create the level playing ground for all companies. We are not siding anyone. We can also create the same opportunity to other people and actors who want to come into the space to improve services in the country.
Also making a statement, the Deputy Chief Medical Officer of Public Health at the Ministry of Health and Sanitation, Dr. Ali H. Wuri, said the Memorandum of Understanding has been signed on the 11th of May 2022 and further that as a ministry they can not only sign an important document like that which they know that it will address long-standing issues in the medical field. He also assured Roche that the government of Sierra Leone and the people are ready to work with them.
This MOU sets forth solely the preliminary intentions of both parties, that's MOHS and Roche, with regards to their collaboration to conclude the project without ever giving rise to any binding obligation of one party to the other, except as regards to confidentiality obligation provided. What he said is that, as Dr. Anderson rightly mentioned earlier on, this is not our final destination. This is opening the way for us to go into collaboration with Roche for us to start addressing some of the critical issues on oncology, on cancer management in the country. Let me come down for our listeners.
The country director of Roche, Philip Anderson, in a statement thanked the government and the people of Sierra Leone, more especially the Ministry of Health and Sanitation, because as Africans, when someone welcomes you into his house and has a handshake with you, it means they have wholeheartedly welcomed you to their home, which he believes that the Memorandum of Understanding is a handshake and a big welcome given to them by the government and the people of Sierra Leone. He went further to assure the government of his company commitment in providing the much needed medical services for the people of Sierra Leone.
We know that all over the world, we've gotten to the point where governments have realized that it is not possible for governments to do it alone. And particularly on our continent, we have similar partnerships in Ghana, and I think last year some of you had did us the honors of traveling to Accra for our cancer summit, and had some interactions with our Ministry of Health. We walked the same journey with them, and we have worked together very well, reaching many, many, many patients with innovative medicines and diagnostics which otherwise they wouldn't have. We have similar ones in Ivory Coast, in South Africa, in Cameroon. We have in DRC and in many other parts of the world, where particularly for health systems like this, we know that we would need to work together with the government in what we call the public-private partnerships to solve the problems of the people. The private sector cannot do it alone, neither can the public sector do it alone. And so we work together, particularly when we share the common objective of life and patient outcomes. And I think for a Ministry of Health and Sanitation, you have a social contract with the people of Sierra Leone to provide them health, which is wealth. And as an organization, we also share the same, and our logos would say that we do now what patients need next. And we are, for our 125th anniversary, we clearly said we are celebrating life.
Roche is the world's largest biotech company which truly definited medicine in oncology, immunology, infectious disease, ophthalmology, and disease of central nerve system. Roche is also the world leader in vitro diagnostics and tissue-based cancer diagnostic, and a frontrunner in diabetes management. For Star TV News in Freetown, George Elliott Sam reporting.